For many, there is no greater joy than bringing a baby into the world. And for most parents, as long as the baby is healthy, gender is not important, considering that every year up to 12,000 babies are born with moderate to severe hearing impairment, and another 12,000 born with lesser degrees of hearing loss. There is a probability that most of these parents are not doing newborn hearing screening. There are rarely outward clues, and unless newborns are tested for hearing loss, it is often not detected until the child is 2 or 3 and first to start talking, as was the case for Precious Wendell, who is almost 4 years. She is an intelligent girl for her age. She's never gone to school, but can be able to write and even blabber a few words. For the family, Elijah Macau, the father, tells us it has not been a walk in the park, as his daughter was born before time and developed rickets, which delayed her development.
First of all, what we noted ni the calcium deficiency ambayo ilimfanya delay kwa kutembea. So wakati alidelay kwa kutembea, tukaanza occupational therapy.
They were then referred to Kenyatta National Hospital Ear, Nose and Throat Unit, where she was found to be having sensorineural hearing loss caused by dysfunctions in the cochlear, the inner part of the ear involved in hearing.
The hearing aids were not responding, or they were responding minimal, because she still could not talk, she could not make any speech.
Dr. Sensorineural, an audiologist at the Nairobi Audiology Center, says hearing loss in children is mainly caused by infection of the inner ear, serious head injuries, noise exposure, general wear and tear, or even accumulated earwax.
And actually cause a hearing loss. For example, drugs such as even quinine. Those are some of the causes, yeah. And then for the adult population, it's exposure to very loud noises, whether it is recreational.
Hearing loss is the most prevalent sensory disability, and it varies in degree.
Have a mild hearing loss. This is where a person cannot hear whispers. You can have a moderate hearing loss. This is where you require somebody to raise their voice a little bit for you to be able to hear. Or you can have profound deafness. This is where even if somebody shouts, you cannot get the speech words that they are saying. You just hear there's a noise, but you can't make out the words.
Dr. Ndegwa adds that for a disability affecting close to 466 million people worldwide, with the risk of affecting 900 million people by 2050, 34 million of them being children, there is need for intervention to prevent, identify and address this silent disability.
Clearly, we need to do something. And one of the things is just basically what we are pleading for in terms of allocating more funding.
Hope is not lost for those with moderate hearing loss. There are various interventions depending on the cause of the disability, which may allow them regain full speech and language.
If a lot of those hair cells have been damaged, then that patient has a profound deafness. And the intervention will be different from the one that you give with a milder loss or nerve deafness. That one requires hearing aids.
The only solution to correct Precious' defect is through cochlear implantation, a surgery on the inner part of the ear responsible for hearing.
So in the case of profound deafness, those hair cells are damaged. And so when we place in an implant surgically there, that electrode array takes over the entire role of that of the hair cells.
Yeah.
The operation is preferred for children under the age of 2, so that the child can gain speech and every word. For Macau's family, time is fast running out. They need 2.8 million to implant the device so that Precious can live her life fully.
So we have really been hit by those views. So I'm just making a kind of appeal.
I met one who was telling me that I should take her to a special school. But I felt no, I have to try all my best. Till now I see it has come to an end. Now that I cannot do what they are telling me.
To help Precious Wendell, you can reach the family through phone number 0722 459 297 or cooperative bank account number 0111 608 1891601 Kimathi branch. 6 months ago, patients could not be able to walk, sit, or grab anything. A very jovial and happy kid she is. The family is now appealing for help to help them do a surgery so that a hearing aid can be sorted out. Ouma Onyango reporting for Talk Health on KUTV, Nairobi.